Good morning, guys. As a part of a repair hair transplantation results series, I would like to present one more such story. We had underwent transplant some other clinic and ended up in having a kind of unnatural results. So it happened to see this patient after first transplant, maybe 1 year results. That's completely a failure transplant, and we repaired this case with very good results. And we're going to discuss in detail what exactly happened with this patient, what went wrong, and how could we corrected this. So that's what it is. Kindly watch the video until then. When we talk about a repair transplantation, usually there are few cases we do second session. That's kind of to achieve the density. And that is a different story. But this story is kind of a repair transplant. Why we can say repair transplant is the first session itself completely failure because of the plan, not because of the density, whatever it is. The way a graft's been implanted, the way plan designed. And so that's how we can say it is a failure transplant and a repair transplant. Well, this patient when approached me to get repaired his hair transplant surgery, which has been done a year back in a different clinic. And during the consultation and examination, we could see this frontal hairline, kind of a horrible hairline where it is placed kind of a single straight lines like that. We can say it's a regular pattern. Usually we have a irregular pattern. And we, after his examination of his scalp, we could observe that a lot of grafts are placed in the lines manner, lines, like it's regularly placed, which is not ideal for getting a nice camouflage. And the density also very thin, and that's what the thing we observed. Well, donor hair was very good to do second session. That's what we recommended, repair transplant surgery with good outcome. So it happened to do the surgery for him. After initial discussion, we planned it for a surgery, and the plan is been given such a way that he's going to get the good results. What went wrong in this patient? First, we need to discuss before planning it. Number one, placement of the grafts were wrong. The pattern of the placement, that was wrong. Pattern of the placement means irregular manner supposed to be placed, but someone has placed in a lines and designed such a way that and regular design. These are the two things which led to a failure transplant. Now in the plan, what we did is, we planned such a way that we are going to remove frontal FUE hairline bunches, kind of plugs, graft plugs, and then we are going to make a single follicles implanted in acute angulations, and we are going to make a irregular placement. That's a plan for this patient. Well, kindly watch after 8 months results too. After 9 months of repair transplantation, it happened to see him in my consultation with fantastic, amazing results. Here, how this was possible was because of the meticulous and best plan, tailored or customized plan for this patient. Usually, what we did in this patient was rectification of the hairline, and other area mid-scalp we made irregular pattern implantation and acute angulations to the skin while implanting. That also led to get more density in this patient. We achieved more density in the hairline and the mid-scalp and a little in the crown area also. These are the customized, tailored plan to the patients we need to design to achieve best outcome. Well, one thing we noticed that the hairline area, especially because of older transplantation plugs, still there are unnaturality. I can see that can be rectified even later anytime, but 90%, 95% of all the corrections has been done in one session. So any further corrections, minor corrections can be done in this patient, but patient is absolutely happy with this outcome as of now. So that is the reason one should choose a best clinic, best surgeon to achieve best results. Thanks for watching.